This is a situation report on epidemiology for the 24th of May. 7-day rate flat, actually flat to going down. As of today is in the mid-30s and trending downwards. Last week was in the mid-40s to almost 50, so it's been coming down for some time now, which is obviously good news. Increasing in children and young people, kids are at school and we're testing a lot, so unsurprisingly it's going up in that group. Increasing slightly in early working age adults, going down and down in the over 50s, and that's undoubtedly the impact of the vaccination. So R is probably just below 1, given the flat to slightly decreasing 7-day rate, not much below 1. And remember that the current 7-day rate is reflecting what was happening a week or 10 days ago. Hospitals, very, very low activity. Don't think that there's no pressure on the NHS. Hospitals are busy trying to organise the elective surgery backlog, and the whole of the NHS and social care is fairly busy with the impact of the lockdown now that that's easing. Primary care is exceptionally busy, and it's important to say, 1, it's open, but 2, it's very busy, and they're still busy vaccinating people as well. With 7 days post step 3 in the roadmap, I think our rates will go back up in the not too distant future. I've been wrong before, I hope to be wrong again, but we'll see. But more mixing indoors, especially in poorly ventilated indoors. So I think that an increase in rate is likely but not inevitable. So we'll remain for early summer balancing rate versus harm versus social and economic impact versus trying to get back to normal, and that will be the business of the public health response over the summer. Keeping a lid on outbreaks, keeping a lid on individual cases and contacts, and continuing to push vaccination. The basics are still the same. If you have symptoms, get a test and isolate. You'll be contacted by contact tracers, and your contacts will be asked to isolate. Hands, space, face, ventilate, vaccinate are the key messages for the summer. Even if you think you're going to be well, there's still the potential of long COVID, and you're still going to have to isolate, so you're still going to be off work or school or university. None of that will change. The future is impossible to predict. We're seeing basically an unforeseen future nestled somewhere in time. I don't know how the future will play out, but the basics will remain the basics throughout. So all up, 297,000 people have been vaccinated with their first dose. That's 90% of over 50s, and 40% of over 50s have now been vaccinated with dose 1. 165,000 have had the second dose, and it continues to be amazing news. Some important things to remember: you're not fully protected with 1 dose, so please make sure you have both doses when you're invited, or a second dose when you're invited. The variant that was identified in India is spreading in this country. The Secretary of State for Health announced that the majority of people who've been hospitalised because of the variant hadn't had the vaccine, even though they were eligible, underscoring it's really important that you have the vaccine. It's the best thing to do to protect you and others. If we want to bring the pandemic to an end and keep Sheffield open, we need everyone to have the vaccine. And if you're in one of the at-risk groups and haven't yet been vaccinated, please call your GP practice or call 119 to book a vaccine. Many community pharmacies in Sheffield have started vaccinating people, and again, that's good. When you call 119 or go onto the national booking website, you'll be able to book an appointment at participating pharmacies across Sheffield. About 8 pharmacies will be available to book from later on this month. So there are still some over 50s that haven't been vaccinated, and it's really important that if you're in that group and haven't had dose 1, you get that done soon. So please call 119. So we'll be pushing that. We'll be expediting or bringing forward second doses in the over 50s and those that are shielding. And it's really, really important to do that to maximise the protection that the vaccination gives. So we're pushing pretty hard to sustainably accelerate the programme. And if you have been offered, please accept it, because it's the single best thing that you can do to protect you and others, and by being vaccinated, reduce transmission and help keep Sheffield open. So this is a brief update on variants of concern. So in my view, in Sheffield, the 4 government tests for the roadmap are still robustly met. Variants of concern are most likely the area where it could go wrong nationally and locally. There are two variants of interest. One is the so-called Yorkshire variant, the AV1, that was announced as a variant of interest by Public Health England last Friday. not terribly concerning from a public health perspective, actually. Certainly not more concerning than the current dominant variant, which is the B117 or the Kent variant. Doesn't appear to be much more dominant, doesn't appear to be any more harmful than the existing variants of the virus that are circulating. Same messages, public health messages apply: hand, space, face, ventilate. If you have symptoms, get a test. The B617.2 or 1.617.2 variant, or the one that originated in India, is of more concern, becoming more dominant in some parts of the UK, likely to become dominant in the UK, difficult to predict when, hasn't yet become dominant in Sheffield, but that probably only a matter of time. Probably a bit easier to spread, a bit more transmissible, almost certainly not more pathogenic, and vaccine efficacy is looking okay, with some caveats which I shall come on to. So yes, it's definitely of concern, no two ways about that. Same basic public health messages apply. We know how to control the virus, and I won't repeat the message, I've repeated it often enough. But the most important thing is when you get offered vaccination, it's really important that you take that up. So the basics do remain the basics. People have talked about surge vaccination. The virus will always outpace vaccination programme, and vaccination programmes are really, really good at protecting individuals and developing population immunity, not a tool to control an outbreak. So the tools that we'll use to control outbreaks are test, trace and isolate, and human behaviour. We will be accelerating the vaccination programme as well, but it's important that we don't rely on just that, because we still need to adhere to the basics.